I wear these hats and people think I'm making a fashion statement or I must be from Texas. But cowboy hats are a tradition in my husband's family. I wear a hat because my husband wears a hat. My husband wears a hat because his father, who passed at the tender age of 94, wore a cowboy hat. Unfortunately, cute stories and stylish hats aren't the only traditions passed down from generation to generation. In Georgia, you're likely to pass down heart disease or diabetes. You're likely to give birth on the side of the road trying to get to a birthing center. And good luck if you need to see an oncologist, because you may need to plan a day trip. I don't know about you, but these aren't the reasons I want Georgia on my mind. But access to quality health care is a challenge that, according to the U.S. Census Bureau, plagues 1.2 million Georgians. That's 4% higher than the rest of the country. But our communities are changing, and access to health networks are expanding. And while these resources are important, it's also important to ensure that the voices of those impacted are not excluded. In public health, we call this patient engagement. We recognize the value of capturing patient voices to improve the lives of the people we love. It's the stories of rural families like my husband and I share while getting chemo on a Monday in Savannah, radiation Tuesday through Friday in Statesboro, and then heading back home to Metter. But it's also sitting in those same waiting rooms, discussing the best rivers to get catfish, the best way to boil peanuts, or the best place to get a low-country boil. But we can't focus on sharing those stories if we're worried about receiving care. And I don't know about you, but I'd rather hear the family traditions. I want to hear the reasons Americans should have Georgia on their minds. But most important, I want us to live to tell those stories. I conduct research that improves healthcare. The concept of research outside of a laboratory can be difficult to grasp. We get this mental image of people in white coats poking and prodding. But Zora Neale Hurston once said, "Research is curiosity at its best. It's poking and prying with a purpose." So if I poke and I pry at your healthcare experiences, it's so I can improve those experiences. And if you've only had positive interactions, then you get to help me take what made those interactions memorable and ensure other Georgians receive similar care. I'd like to share with you the stories of families just like yours. And in return, I'd like you to consider how sharing your seasons of illness or affliction might help give others hope. You know, it's the very poignant aspect about sitting in a waiting room where we're all the same. Think about that for a moment. Race, gender, religion don't seem to matter as much in these spaces. We're all there because we all need help. We all need hope. And while there are many things outside of this context we might disagree on, I believe there are a few things we can all agree on. And each of these can be found on the Georgia Public Policy Foundation's website. 1, it's never good when a man loses his wife shortly after giving birth to their child. But it's a sad but true fact that Georgia has the second highest maternal mortality rate in the country. It's never good when a parent loses their child because they overdose on a drug they never intended to take. For every 100,000 Georgians, 3,000 will die from opioid overdose, and half of those will be from fentanyl. It's never good that we have to travel 4 hours to see a specialist because there's a physician shortage in rural Georgia. Georgia has 159 counties, and 9 of them don't have a single physician. I recognize that many of you have never had these experiences, and I hope that you never do. But if you'll indulge me for a moment, I'd like for you to come with me on a quick journey. Imagine yourself walking into a large hospital in a busy city. You're not from the area, and so you're trying to navigate parking, check-in, questioning, did we bring everything? You ask the woman at the front desk, excuse me, how do we get to urology? And she asks, urology or oncology urology? Oncology urology. She says, take the elevators to the 4th floor, you'll see another check-in desk. And so you do. You take the elevators to the 4th floor. Of course, there's no check-in desk. But when you finally see it, the gentleman asks, what are you here for? And you think to yourself, it's oncology. We're here for the same reason everyone else is. But instead of giving a cheeky response, you say, we're here to review biopsy results. He says, okay, we have you, please have a seat. And so you wait 20 minutes before being taken into a patient room in the back where you wait another 60 minutes. And the doctor comes in with a brown patient folder in his hand. He greets you and opens the folder. Can we all agree? It's never good when an oncologist pauses before giving you your biopsy results. But 50,000 Georgians will receive a diagnosis of cancer every single year. Why morbid statistics? Because there's something you can do. Make your experiences count. I can't bring back your son or daughter. I can't give you the life you had before the diagnosis. But what I can do is work with you to ensure other Georgians have hope. There's a scripture that says, for everything that was written in the past was written to teach us, so that through the scriptures and the endurance they teach, we might have hope. Each of you is a part of a family, and your family has traditions they'd like to pass on, whether it's a peach cobbler recipe, a knitted blanket, fancy hat. I'd like to hold space for your lived experiences, and I hope you walk away today with a curiosity about how you can help and how you can offer hope. And together, we'll create the reasons Americans should have Georgia on their minds.